Question, sir.
Yes, I got first a comment and then a question.
Yes, sir.
Now, we all can be in a total agreement that we got a healthcare system we can't afford.
Yes, sir.
And using your facts stating that we're spending 25% of what we did in 1960, when you're saying that then we spent $48 out of our pocket compared to
$12, yeah. Mm-hmm.
Okay, so, and then you look at how far we've advanced and, you know, the more expensive procedures, MRIs, all this other stuff.
Mm-hmm.
We absolutely know we can't sustain this.
Right.
Now, Blue Cross Blue Shield in North Dakota is nonprofit. It has the lowest insurance throughout the United States from what we've been told. Would you be in favor of having a healthcare system run by the private sector as a nonprofit?
Well, most hospitals in Minnesota are nonprofit.
Just in Minnesota, but I'm just saying.
Yeah, all insurance companies in Minnesota, they don't have to be nonprofit, but most of them are nonprofit. I think nonprofit is really a misleading statement. Nonprofits have to have retained earnings if they're going to go on. Oftentimes they share their retained earnings with executives instead of stockholders. So I don't think that's the answer. I think the answer is more basic than that. I think the answer is in creating a consumer society in which we have an obligation to participate. In our book, The Solution Consumers, where we teach people how to buy health care, for instance, we teach you to say, how much does it cost? Very simple question.
My second question is, Michelle Bachmann has stated that Medicare Part D is unconstitutional, and she said if she would have been in the House at that time, she would have voted against it. But we never hear anybody wanting to repeal Medicare Part D because it's, you know,
popular,
unconstitutional.
Yeah,
would
it's
you
popular.
be in favor of eliminating do you think it's constitutional, or should
you know, this is going to sound like a political answer. I've never heard that argument from her, so I would have to read what her justification is for that. What would make it unconstitutional? I mean, how is she construing the argument? I don't know what it is.
It's not in the Constitution as far as like.
Right, it's not an enumerated power, and neither is Medicare, you know.
I mean, that would fall under the same category, and we're not willing to pay for that right now, and we're just passing that on to our grandkids.
Yep. Yeah, there's a lot of things that are unconstitutional that we sanction, and maybe by the fact that we sanction them, they're constitutional by default. How do you roll that back? I don't know if it can be rolled back, but I don't know her. I don't know what her logic is, you know. So I apologize. I don't know the answer.
Thank you.
Yes.
Question on how they determine insured and uninsured. I've lived in 8 different states, and I've known people that say they don't pay premiums like I paid, but yet whenever they needed medical, they could go to different clinics and get medical. They went to the hospitals, and the hospitals over there and took care of them. I don't know if anybody, in all my travels, that's ever been turned down by something, and now we come up with this, which is supposed to enhance that. Is that what we're saying?
To some extent, your analysis is correct. There is what's called EMTALA. It's a law that says that no hospital can turn you away for an emergency condition. They have to treat it. If they don't think it's an emergency, they can send you down the road. And I suppose that might be happening more than it used to. So individuals who have no assets can go in and get emergency care in an emergency room. That's the most expensive health care there is. The much better solution is to have community health centers available everywhere.
But every state has that.
Yes, they do.
Every town that I've been in, as far as a large town, has that.
Yep, even small towns do. I don't know the number in Minnesota. There used to be 94. We did a search years ago.
How do they then say that the people are not insured?
Well, they're not insured technically because they're not enrolled in a plan of any kind. There is a group that says, and the number keeps going up, and there's no study that I'm aware of to justify the number. They used to say 18,000 people die every year because they don't have health insurance. I suspect they die because they got sick from something myself, but you know, could they get care? Well, what do you do with a guy who lives under a bridge? You know, one of the problems Medicaid has is people do get enrolled, they get sick, they go in, they get enrolled while they're in the hospital. The hospital enrolls them for good reason. It's a way to get paid, something anyway, and I don't deny that. That makes sense. But then 3 months later, they're on the street and they're not enrolled anymore. A lot of them don't even have telephones. So then to solve that problem, we have to have the human right to own a cell phone. You know, and I mean, this sounds really cynical, but I'm telling you that's a reality. You have a mother with 4 children living out of a car who changes classrooms for her kids every 3 days. How are you ever going to get her enrolled in something? Well, the new system uses something called navigators, who are can be anybody. They can be like your fishing club, your hunting club, you know, agriculture society that will help you get to the exchange and enroll in health care. Fine, get them enrolled. They're not going to stay enrolled, especially with guarantee issue and no pre-existing condition penalties. Everybody pays more. You know, one of the statistics that we've been told is the premiums are going down with the exchanges. The chief consultant in the state of Minnesota is a guy named John Gruber. John Gruber designed the Massachusetts connector, and he designed actually the ObamaCare exchange. Last February in his report to Minnesota, he said premiums are going up 26 to 40% on individual health plans. But 70% of the people won't notice it because we have tax subsidies to buy it down. Of course, the people who are paying the taxes will notice it because they won't have money in their pocket. But what he doesn't tell you is if you earn $107,000 in family income, your premiums are going up 110%. He doesn't tell you that. That's what this thing is about. You know, guarantee issue and no pre-existing condition sounds really, really good until you start paying for it. And it's very expensive. We have in Minnesota something called a high-risk pool. We were the first state in the nation, well, along with Connecticut, to do this, 1976. You have guarantee issue in Minnesota. If you get sick, you can get health care. Now, there is a waiting period, even under that plan, and it costs you a little more than private health insurance in a commercial carrier. But we've had it always since 76. The new law kind of creates this out of whole cloth. They throw the healthy people together with the unhealthy people, and then the rates are higher for healthy people and lower for unhealthy people. That's the idea. So, it's complicated stuff. Yes, sir.
Yeah, a couple questions. Is there a 3.8% tax when you sell your home, number one? And number two, what do you think, how much would tort reform have helped this situation?
Let me take tort reform first, and then we'll take the other question. Tort reform is a limit on payments to plaintiffs in a wrongful injury or malpractice suit. Some states have put in like $250,000 on punitive damages, which means that the attorney can't get contingency fees by winning multi-million-dollar settlements. That's a little cynical. And it has mitigated the cost of malpractice insurance in many states. Texas is a leader in this, by the way. That's a lot of doctors have gone to Texas for that reason. So tort reform would help if we were to cap. You know, we want doctors who make a mistake to have to pay for their mistakes. That's why you have insurance. But they didn't do it with criminal intention. If they did put them in prison, that's a different decision. So yes, we need tort reform. We have a chapter in our book, chapter 6, about defensive doctoring. 74% of doctors admit to defensive doctoring. That means they're assigning tests not because they're necessary, but because sometimes you ask for them and they don't want to say no. My condition, I had a stress attack. Can you imagine me having a stress attack? 2008, and I'm laying in the ER. I had two EKGs, blood tests, and x-ray, and the doctor says, Mr. Racer, you look like you're in pretty good shape. I think you just were kind of under stress. I said, do you think so? Anyway, he says, but I want you to stay overnight in the hospital and have a nuclear stress test tomorrow. I said, doctor, I'm not staying in the hospital, but I will have the nuclear stress test if you want. He says, well, you might have to wait a week. I said, I'll chance it. And I said, I know what you're doing. And he said, what do you mean? I said, I wrote a book about defensive doctoring. And he looked at me and he says, do you know that most heart attacks happen, most of the claims they get in ERs are people who go home, just like me, and have a heart attack. So, okay, so that's the one. Now the 3.8% on the sale of your home. Here's the only way this would happen. Okay? You earn $250,000 as a couple. The next dollar is taxed at 3.8%. Okay? If you sell your home and you have net income in excess of $250,000, you'll pay the tax because it is on unearned income. But you have to have that. In fact, there's a $500,000 exclusion, I'm pretty sure. So you've got to have a pretty pricey home before you'll ever pay that tax. I've answered that question on the internet, I can't tell you how many times. That's a little bit of folklore. You'd really have to have a huge gain to pay on that. Yes, sir?
How about the 1% tax on the additions to your bank account or subtractions from your bank account? They want to put your Social Security check on
Deposits.
electronic payments. And they're going to whack with the 1% charge when that goes into your bank, and when you write a check, take it out, they whack with another 1%.
That's not related to the health care law, though. I've never heard that related to the health care law. That might be something else. You are paying more taxes on premium on insurance, you're paying more taxes on medical devices, and you're paying more taxes on pharmaceuticals. Though. Yes, sir?
How do you feel about a federal exchange compared to a state exchange?
We don't need an exchange at all, period. The exchange is only there to get more people enrolled in government-subsidized health plans. We don't need it. Doesn't save a penny.
Of course, so then you would be against a state exchange because that would be closer and quicker than the federal exchange.
I'd rather have a state exchange than a federal exchange, but it depends on how the rules are written. Here's the dirty little secret. The federal government is nowhere near being ready to launch these federal exchanges. They didn't know they were going to get this pushback. We've already heard they would delay at least 6 months implementation because they're so far away from being ready. What they're going to try to do is partner with states. So the best thing that would happen, this is what I told one of the senior officials at the exchange. I had coffee with him last Friday. He says, well, what do you think is going to happen, David? And I said, well, it depends on who gets elected. If Romney gets elected and he gets a Republican House and Senate, you're out of business. And he looked at me and he said, what do you mean? I said, you're not going to have any money. They're going to defund you. And he said, well, we could still do Medicaid. I said, I know you could, because guess what? That's what it's all about anyway, isn't it? And he got chuckled, because once you pass an exchange, it's very hard not to have it. It's very hard to roll these things back. Okay. So what did you ask me? I totally forgot.
Well, that's kind of my question. If we go to an exchange, but a state refuses to either put federal or state in, what really is the state's option?
The state can refuse the federal government to come and impose its exchange on the state, and people can buy or not buy there. You know, only 10% of small business buy from the Massachusetts connector, even though it's mandatory in Massachusetts. You have health insurance, they don't go there. 80% of the people that buy individual plans there are subsidized by a government tax, because you can still buy in the private market. Yes?
Probably more of a comment, but how is it that the federal employees are exempt from being part of this change when it's Harry Reid and Nancy Pelosi that designed it, but they don't have to be part of it?
Well, what's rather fascinating is there's very specific language in the bill that actually passed that says that they will be part of it.
They will.
Very specific. Members of Congress does not include the staff members. The staff members wrote the law. The legislators passed the law. I feel fairly certain they will change that at some point.
Does Pelosi know this?
Might be one of those things she learned after the fact, yes. Yes. Yes, sir.
What's your opinion of AARP?
I'm a member of a different group. AMAC.
That's good.
I graduated from high school in 1965. I apologize. We were the class that screwed up the whole country, you know. You remember when they used to burn bras and then they'd burn draft cards? If anybody in this room has an AARP card, put it out. We're going to burn it right now. We're joining 60 plus, I think it's called, or AMAC. Does that answer your question?
Oh,
yeah.
I got a letter and a card in the mail today, and I cut it into 4 pieces and stuck it in my...
Yay, there's a hero. Yeah.
really need to call them though and tell them.
No, you need to take their envelope,
Yeah,
seal it,
Send it back.
empty,
Yeah.
send it back.
Yeah. Oh,
My wife would be mad at me for doing that. I co-authored a book last summer called Medicrats, M-E-D-I-Crats, Medicrats. Medicrats are people who manage, bureaucrats who manage healthcare both in the private and public sector. And there was a reason I told you that. Oh, in that book, we did a study of AARP and where they make their money. $800 million a year off of selling products to you. I mean, they make very little off of their membership. That's why it's so cheap, but they make a lot of money off advertising and selling insurance products. $1.3 billion is what their income was 2 years ago. That's like AMA. That's why I knew that statistic about their, they make more money off of selling CPT codes than anything. You know who belongs to the AMA, American Medical Association? Roughly 15% of all licensed physicians, and most of the ones that belong are retired or they're students. Practicing doctors, as a rule, do not belong to the AMA. They belong to their own subspecialty groups because they don't represent doctors. And AARP, I don't know who they represent. Themselves, I guess. That's a great question. That's the best one tonight, right there.